Hi everyone, my name is Daniela Elisa Panesanton, and today I will talk about disorders of fluids and electrolytes, mainly intravenous fluids in acutely patients. Contents, definition, application in medicine, pros and cons, issue in Ecuador, symptoms, and conclusion. Definition. Disorder of fluids and electrolytes are alterations in the content of water or electrolytes in the human body when the amount of these substances decrease or increase. It has varied causes. One of the most important are diarrheal disease that, together with other factors such as high temperature, poorly washed food, or poor hydration, cause an imbalance in the proper functioning of the body. Older adults and children begin the most affected groups.
The electrolyte balance in the body's fluids is absolutely crucial to many body processes, and any imbalances can cause serious disorders and can even be life-threatening. As described in an earlier program, the fluids in the body are filled with dissolved salts and minerals that take on plus or minus electrical charges and are called ions or electrolytes. The common electrolytes sodium, potassium, and calcium take on positive charges in a fluid and are called cations. And chloride, bicarbonate, and phosphate take on negative charges and are called anions. The concentration and charges of these electrolytes have a lot to do with how fluids move through the body and also how they pass through membranes into and out of cells and blood vessels. Osmosis, diffusion, and active transport are all processes of fluid transfer through membranes that are dependent on the concentrations of electrolytes. Imbalances in electrolytes can disrupt this flow of fluids and cause many pathological conditions. This program will discuss imbalances in some of the main electrolytes in the body.
Application in medicine. Administration of hypotonic intravenous fluids for maintenance is common in both children and adults. It is associated with a high incidence of acquired hyponatremia and with iatrogenic disc or permanent neurological deterioration related to hyponatremic encephalopathy. Acute patients may have disease that alter water homeostasis, so both the rate and the composition of the intravenous fluid must be carefully indicated. Isotonic liquids are the most appropriate.
Normal saline is a commonly used isotonic intravenous crystalloid fluid. Although it was created to approximate the same osmolarity as human plasma, normal saline contains higher sodium and chloride concentrations than plasma, and its infusion can lead to hyperchloremic metabolic acidosis and kidney injury. Balanced crystalloid solutions, such as lactated ringers and plasma light A, have more physiologic electrolyte concentrations and thus may have less negative impact on acutely ill patients. In the single-center pragmatic unblinded SALT-ED trial, investigators tested whether the composition of crystalloids affected outcomes in non-critically ill patients. Over 16 months, the trial enrolled 13,347 adults who received 500 milliliters or more of isotonic crystalloids in the emergency department and were subsequently hospitalized, but not in an ICU. In alternate months, participants were assigned to receive either balanced crystalloids or saline. The median crystalloid volume received was 1,079 milliliters, and 88.3% of patients received only the assigned fluid. The primary outcome of hospital-free days, defined as days alive after discharge before day 28, was the same in the balanced crystalloids group and the saline group, 25 days versus 25 days. Patients in the balanced crystalloids group had a lower incidence of the secondary outcome of major adverse kidney events within 30 days, which was a composite of death, renal replacement therapy, and persistent renal dysfunction, 4.7% versus 5.6%. A concurrent study performed among critically ill patients also showed a reduction in major adverse kidney events within 30 days, 14.3% with balanced crystalloids versus 15.4% with saline. The authors conclude that among non-critically ill adults, balanced crystalloids and saline resulted in no difference in hospital-free days. Full trial results are available at nejm.org.
Pros and cons. Maintenance intravenous fluids are used to provide critical supportive care for patients who are acutely ill. IVF are required if sufficient fluids cannot be provided by using enteral administration for reasons such as gastrointestinal illness, respiratory compromise, neurologic impairments, a perioperative state, or became moribund from an acute or chronic illness. Concerns have been raised that this approach results in a high incidence of hyponatremia and that isotonic IVF could prevent the development of hyponatremia.
True hyponatremia is when you have a low serum sodium concentration along with low osmolality and low tonicity. This causes water to move into the cells. That sodium is osmotically active. You get a relatively higher concentration inside the cells, and so you get water movement into the cells. Hyponatremia is due to more water intake than excretion. As long as water intake equals water out, sodium remains in balance. If fluid intake exceeds urine output, sodium falls. This can occur in 3 different scenarios. 1, renal failure. No urine output, you're always going to have more intake than excretion. Obsessive water drinking, just drinking so much that even healthy kidneys can't keep up. And lastly, normal water intake with low urine output, but not renal failure. Here's a summary of what we just described. No urine output with normal water intake is renal failure. Normal water intake with decreased urine output is the last one we described. And then compulsive water drinking with maximal but still inadequate urine output. Let's look at the first one. This happens with dialysis or end-stage renal disease. Anything which prevents the patient from making urine predisposes them to hyponatremia. They're naturally going to drink more water than they can excrete. The next one we're going to talk about is the last one on the list, compulsive water drinking with maximal but inadequate urine output. These are tragic situations in which people just have compulsive water drinking. People with schizophrenia are predisposed to this. It may be, in some degree, due to the anticholinergic drugs they take, increasing thirst. But then the other ones are just games people play. Here's some headlines of people that have died from acute water intoxication. This is all due to cerebral edema associated with hyponatremia. You need to drink an incredible amount of water to get these symptoms. 18 liters is the maximum daily urine output. So you're looking at 9 2-liter bottles a day to cause this type of hyponatremia. So we've gone over no urine output with normal water intake and compulsive water drinking with maximal but inadequate urine output. And we've left this middle one for future chapters. This middle one is the real big sweet spot in hyponatremia.
Is applied in Ecuador. The degree of knowledge in intravenous fluid therapy in medical personnel in many hospitals in Ecuador is poor. Symptoms: sickness, weakness, muscle pains, dehydration, swelling, slow breathing, excessive tears, dry mouth, dark color urine.
Dialysis works to remove excess waste, toxins, and fluid from your body for chemically balanced blood and healthy amount of fluid. You can give your treatment a big boost and be your healthiest by limiting the amount of fluids you consume. Learning these fluid tips will help make your dialysis most effective and keep you feeling better. Shake off the salt. Managing your salt or sodium intake is important. Too much salt in your diet will make you feel thirstier. Choose foods with a percentage daily value of less than 10%. Avoid fluid traps, situations when you think you might just be drinking out of habit. If you're craving fluids, wait 10 minutes until the craving passes. Call someone or find another way to distract yourself. And when it's time to take your medications, try taking them with applesauce instead of a drink. Just chill. Find ways to keep yourself cool on hot days. Use a mist bottle with a fan attached. Wear loose-fitting clothing. And if you're outdoors, pick a shady spot. Foods can be fluids too, like popsicles, sorbet, ice cream, and watermelon. If it melts into a liquid, it's a fluid. Great snack choices to help quench your thirst include sugar-free gum and sugar-free hard candy. Also, frozen grapes, or freeze your favorite beverage in a bottle and sip as the fluid melts. Defeat dry mouth. Rinse your mouth or try using alcohol-free mouth spray. Remember, fluids are usually limited on a dialysis diet. Your care team will help you learn the exact amount of fluid you may have each day. So learn the fluid tips and stick to your prescribed treatment to feel your best. Visit freseniuskidneycare.com/fluid.
Conclusion. Electrolyte disturbance can arise from excess or actually defeat of the same with a normal body water level, or of a related excess or defeat, because the body water level has increased or decreased. By therefore, any situation that creates an imbalance between the inputs and outputs of water and electrolytes will cause electrolyte disturbance.
Salt and water are essential components in the body. Imbalances in the amounts or proportions of these components can lead to disease. Too little fluid on certain surfaces causes cystic fibrosis, a disease which shortens the life of patients through chronic lung infections, intestinal obstruction, and inability to digest food. Too much fluid in the GI tract leads to diarrhea, the second most common cause of death worldwide in children under the age of 5. Fluid in the wrong location causes polycystic kidney disease, leading to kidney failure. Currently, there is no treatment for this condition. I am Bill Gugino, and my lab studies the tiny channels that move salt and water that cause these diseases. Understanding their fundamental biology has produced new drugs for cystic fibrosis, new leads in combating diarrhea, and will provide new hope for patients with polycystic kidney disease.